I'm Lila Lazarus. We all feel tired sometimes. Slow moving, low energy. Sometimes it lasts a day, sometimes maybe even a week. But then there's that inner voice that tells you, this isn't right. This feels more serious. Dr. Melissa Sundermann is a general practitioner with Trinity Health IHA. Can you define fatigue?
That's a great question, Lila. And I think it's so subjective, right? Because what fatigue means to one person is different than another person. It's kind of like, what is pain, right? I mean, that scale is, I have some patients that say, oh, I have a high tolerance for pain, and other patients that say, oh, I have a low tolerance. I think that's kind of like fatigue. And for some of my patients who've been living with fatigue, that's just the baseline. So one of the issues is that fatigue is a very subjective symptom, right? It's actually a diagnosis. If it's a diagnosis, I can sometimes in my assessment say generalized fatigue, but it's also a symptom of just very subjectiveness. So that's one of the issues. And, one of the studies that I think we'll talk about is how do we really quantify fatigue?
But how do you know it's fatigue, and when is it something more serious, something that needs a doctor's attention?
So I think that's when you need to have a good relationship with your primary care physician. And I encourage all individuals, especially as we get older, to have a primary care physician. I'm in my 50s. It's so important that we are doing prevention, primary prevention, and that you have a good relationship and that you really are in tune with your own body to know, gosh, I used to be able to go for a bike ride for an hour. Now, after about 20 minutes, I'm just feeling more winded. I'm just not able to recover as well. So just sort of knowing your body well enough to know, what feels slightly different, and having a good relationship and accessibility to a primary care physician as a place to start to say something just doesn't feel right. So I completely trust my patients when they say, something just feels off. And then we can take a deeper dive into explore what that is, because the range of diagnoses or issues that could cause fatigue can range from mental health issues to feeling emotionally stressed, to being depressed, to heart failure.
So if people have been feeling tired for some time, how long should they wait before they call the doctor?
If you're, feeling, a couple of weeks that you're just feeling off, that's the time to call your doctor. I mean, I think that with COVID going around and lots of viruses and colds, sometimes you just might feel off kilter. And it takes, if you have a virus, it might take a week and a half to kind of move through that. But if this is a couple of weeks, that's the time to reach out to your primary care physician.
When do you know it's a sign of something more serious? Is it when you have a fever, a change of appetite?
Yeah, change of appetite, fever, shortness of breath, right? Shortness of breath that, obviously, if I tell you to go run a sprint and you're like, oh God, I got really short of breath doing that, or doing a high intensity workout. But if you're doing your activities of daily living, if you're doing housework that you normally are able to do, and you're like, God, I'm getting really short of breath. My laundry room is in the basement, and usually I'm able to do my laundry no problem. And now I'm finding it really hard to go up and down the stairs. That's unusual for me. Or when I'm exerting myself, even going for a walk, I start to feel some chest heaviness, or I have leg swelling. That's not normal, or so again, trying to find out some of these symptoms that could be related and causing the fatigue.
A recent study said fatigue could be a sign of early death within 3 years for some older adults.
I read the study too, and I think that it's a very important study for us as patients and individuals, but also as providers to take this very seriously, and not just say, you're not sleeping well, just get better, go to bed earlier. And what was really important that I learned in this study, and I'm going to use clinically, is there's actually a validated scale to try to quantify fatigue, because I said it's a very subjective. So it's called the Pittsburgh Fatigability Scale. And so you're supposed to answer from a scale of 0 to 5. From 0 being no fatigue to 5 being extreme fatigue. If you took a leisurely walk for 30 minutes, no fatigue, extreme fatigue. If you did light housework, such as dusting, cleaning, baking, dishwashing, if you did heavy yard work, like pushing a lawnmower, weeding, planting, or another question is watching TV for 2 hours. How tired do you get physically? And then also they ask you to rate 0 to 5 for mental fatigue. Participating in social activity for an hour, like if you go out to dinner with friends, or you're at the senior center and playing cards, How fatigued are you physically, mentally? The individuals who scored 25 or higher, they had a 2.7 higher chance, almost double chance of dying in the next 2.7 years. The higher you score on this Fatigability 10 question questionnaire, the higher your risk of death in the next, like you said, 3 years can be. So I think that we need to take a very serious note when our patients are saying that they're fatigued.
These days, it seems like everybody's battling fatigue, feeling so tired. Are you seeing more of it in your practice?
I absolutely am. A lot of people have had COVID, and we actually have been seeing like long COVID. So these symptoms that are a multitude of symptoms of fatigue and brain fog and joint aches. And it's so new to all of us that, we're still trying to figure it out. Also, when everyone had to be socially isolated, I think that just, we were stuck at home, that put a huge toll on us. And a lot of my patients are now working remotely, which has its bonuses, but staring at a screen all day long and not moving, right? So I am a big proponent of movement. I told you, kind of look like this because I just got back from my morning run outside. So I think movement every day and nature every day is so important. So you got to get up and move.
I love your message. For those of us who just want more energy, more vim and vigor, what are the best ways to combat fatigue?
First of all, you want to make sure that there's not an underlying medical cause, right? Because fatigue can manifest from anemia, from pulmonary issues such as COPD, from heart disease, from, underlying, viruses, from sleep apnea, that needs to be treated with a CPAP machine, early stages of dementia, autoimmune diseases. So I think that first of all, we need to make sure you need to see your doctor to make sure that there's not an underlying cause. But the best way to combat your fatigue is to actually move. Movement does not mean you have to go to the gym at Planet Fitness and lift heavy weights. Absolutely not. If you love to do that, good for you. Keep doing it. But movement, especially as we get older, is, I've got patients that bird watch, that garden, that, find friends to go on a walk with or go hiking or even fishing, even fishing and the movement of your arms and getting that mobility and range of motion is great. Kayaking and biking. So I think that you just want to move your body, or I say, put on a music and dance, dance in your home. I don't care what you do, hula hoop, And the thing about movement is you never regret doing it.
Here's the deal. Feeling tired, feeling fatigued is expected more as we age than when we're young. There are things, though, that we can do to restore our energy and zest. But there are also some conditions that might cause this that require our seeking medical help. Take notice of your fatigue and take it seriously, even if it just means getting a good night's sleep. Thank you so much, Dr. Melissa Sundermann. I'm going to go hula hoop.
I would love that, Lila. I'm a horrible hula hoop. My office manager is amazing, and she's got a weighted hula hoop, but you go for it. I still haven't figured out that motion yet.
Thanks, Doc.
No problem.
Make sure you check out Gracefully Greying on Facebook, Instagram, Twitter, LinkedIn, YouTube, or at the website, gracefullygreying.com.